Welcome back. As we earlier said, we're going to be focusing over 100 healthy days, another very successful, powerful health campaign, presidential campaign, according to the directives of President Abdel Fattah el-Sisi. And this campaign uses over 5,000 primary care units nationwide. The campaign includes 500 medical convoys to offer checkup, treatment, testing, screening services at the state's expense, while 53 mobile clinics have also been deployed to public and crowded places. And this campaign runs from 9 a.m. to 9 p.m. with trained medical cadres serving citizens, and all the services are provided for free. And with us live over the phone is our prominent guest, Dr. Hoda Rezkana. She is head of the Intensive Care Unit, Faculty of Medicine, Cairo University. Good morning, Dr. Rezkana.
Good morning, good morning. How are you?
I'm fine, thank you so much. It's my pleasure having you today on the Breakfast Show. Let's first talk about this good news, launching another presidential campaign for the eyes of Egyptian citizens to care for their health and 100 healthy lives. It's a campaign that's serving everywhere and for free. Talk to us about the details, please.
Well, as a matter of fact, this is another surprising step to the presidential campaigns, as we are usually used to have this from President Sisi, how much he cares for the health and how they are starting to focus on the health is the key to every success. So Egyptian health is mandatory and of a big empowerment for the motivation and the sustainable development of this country. As we can see that it's focused all over the areas of the health aspects, which sometimes the people cannot go for investigation and examination regularly. And because of the high cost and because of the maybe the distances between them and the other specialized centers to get through. And that's why this campaign it will face a good health scale, high scale for attention and for caring to the people. They will feel that the government also take care of them. So I think this is a very, first of all, it's unique and the whole world, and we can see that a lot of people are watching us right now all over the world also for the idea and the brightness of the campaign itself. And a lot of people there say, why don't we enjoy the same treatment as Egyptians do? So maybe this is one of the areas. But the most important is that people can attain this healthcare services, and they know about their health and their power to perform and to have a healthy and healthy life for their children, and because there is no age limit. There is the mother and there is the father and maybe the sons also, the children, they can enjoy the same service. So this is the wonder of this service, and the campaign itself, it will declare a lot of items which we need to know about our health system and our body status, as we are facing a lot of hazards all over the world.
Right. Well, actually, there are, of course, many types of health services this presidential campaign is providing for the citizens. There is specialties that are also present at the clinics, the spread clinics everywhere. We need to know about the different specialities that are served for the citizens.
Well, as I told you before, it will declare the status, the human blood status, of course, first by examining the blood of the people and having a lab test according to their, kidney function and liver function, all these functions in the body, cardiac status, and they have a report about this, and this will be registered in their names and under their special ID number. So anytime you pull it from the computer, you see a good map about this person. Also, if they found out any area which needs further examination, they proceed and they give the patient the area to how to proceed further if he needs more examination by X-ray or test for any itemized renal or acute respiratory or something like that. They will go and further step by step. So this is a primary care service, which is very, very promising, that we can declare and make a map, health map, to all Egypt and see. Even the governorates will differ from one area to other area.
Right.
And we will discover that a lot of children, they suffer from anemia in certain governorates, as in Fayoum, of course, because the land there deprived from iron. So they can supply iron in the primary breakfast or food they take, the children, and they follow up this. So the intelligence, the IQ will rise, and the output from this brain will be perfect. Other areas are full of also area for the kidney or renal, which we can let us seek that the water and the healthy water there or not. So this will be a good indicative and good tools to diagnose which area needs health care and declaration. And this will also incorporate a lot of the services in the government itself. If there is environmental care, or there is more lab work, or there is care for the services, which is basically supplying water and food. This is very important to alarm and to put a landmark to the government to work on these areas if we need help.
Right. So there is also pediatrics, of course, pediatric surgery, obstetrics, gynecology, dermatology, ophthalmology, teeth.
This is an output for the diagnosis they will claim to.
So that's great.
There is an area for final diagnosis for each case, and PhD doctors and specialized doctors will monitor these results, and they can give a declaration that these people need so and so and so, and this makes it easy to diagnose and to treat. The treatment here will give you a good result, because we need every person in Egypt healthy and empowered and capable of performing his task. If she's a mother, she will do her work for the children and for her job and for her house. Also, men also will take care of themselves, because if they suffer something. We will also diagnose early addiction symptoms, because respiratory examination and X-rays and all that stuff will give you landmarks for areas of also, which is the weak points. If we have area invaded by smokers or people who are not putting their health first priority, because they smoke a lot, they don't care for their lungs, and healthy lung is very important also. Also, it will give you a map if they need support by healthy life more than sport and healthy food, and they can be guided by health and dietitian or people who are expert in their areas, which is defective by declaration in their lab results or blood results, and also the X-ray, because it gives you early also diagnosis for cancers. So we will enjoy something it's a first priority and first in the history of the medical field in Egypt, and that we will salute the President's campaign for this health declaration and campaign. And I may say that it will take a lot of effort, but we all support this area.
Right, that sounds great. And also, there might be a problem of the awareness of some citizens, especially in the rural areas, in the informal settlements, and some places out of the skirts of the city. Those people might have a low awareness point. They might not care very much. They might not think that this is important. So this might form a hurdle or a problem in the face of this campaign. So talking about the location of those units, medical units that are spread all over Egypt, how can they be reached by everyone? And how can they, talk about themselves or introduce themselves to the citizens? I mean, the illiterate people.
Well, as a matter of fact, the people in the rural areas, they feel happy. They see the Minister of Health cars and the people coming and doctors wearing white coats and examining them. I think they will feel flattered and feel more happy that the government take care of them. And there is some follow-up for their health. And I think, on the contrary, the people who cooperate will not fear these people, because they need attention, they need support, and they need somebody, because if she's thinking to have an examination on her abdomen or her chest, or she's suffering from renal colic, she will measure the distance from her village to the center or the specialized clinic in the main town. So this is give it easy access to these people and make them reachable, and they will feel that they are well taken care for them. So I wouldn't say this will feel them fear. No, they feel trusty, they feel more happy, and they feel that there is somebody who's caring for them and paying attention for their health. And I think also the children needs more attention and more caring than we need, we say, as in the right now. Because when you reach them in their schools or their villages, you find out that some people are not in the schools. There is a leak here. So maybe we'll discover pitfalls and errors in the system there, so we can reach for direction, director steps, and also for more holistic treatment, not only by diagnosing and give them treatment, no, by follow-up and making a card for each student and for each family, and see there is any pluses or minuses in this family regarding their blood examination or history of cancer or history of lung diseases or history of renal diseases, all that, and they to each area, which gives attention. And also the healthcare system should be aware, calculating all these pitfalls, these areas.
Right. The reason why I asked that is that not because people might, some people, illiterate people might be in fear of reaching those units. No, it's not about the fear. It's about the awareness, the medical awareness about those people. Because
maybe also this is
exactly
a big
what I wanted to say.
media,
what I wanted to talk about is that the medical, right? What I wanted to talk about.
another campaign on TV, on radio, that you have to receive these people who are coming for so and so.
Exactly.
Because maybe a lot of quacks coming in between and they steal or do something bad.
Exactly.
This is the area.
Dr. Rezkana.
That should be campaign accompanied by, of course, the governorate police or governorate responsible people and the health service people, and the ID, of course, will give the people data which gives
exactly.
you
Dr.
assurance.
Dr. Rezkana, what I wanted to talk about is that the awareness of people, the role of awareness, spreading awareness, because most of the people, sometimes it's not only in Egypt, but it's in the Middle East, worldwide, everywhere in rural areas, people are less aware than people in the city. So the people, I mean, doctors and medical staff, they do their jobs. They go beyond even their jobs, and they help people, they stretch their hands to assist them. But at the same time, is there any type of awareness, I mean, considering like when you talked about pediatrics, when you talked about children, lack of vitamins, I mean, some deficiency in the building of those, I mean, the bodies of those children, would require some nutritional awareness, some medical awareness to the mothers, I mean the pregnant mothers, elderly people in the rural areas. It doesn't end only on the medical care, but also would prolong or go beyond that to teach them how to care for their cases, for their lives, for their nutritional, I mean, the daily life routine and everything. Is that in the map also, I mean, in the plan?
Well, I think this should be a holistic approach to people. What I mean by holistic, that you are doing the whole campaign with all the items we need to know about. First of all, introductory period, preparation for the people to know that there is some people who are coming to you for so and so and so. And this is healthy, and this is good for your health and for your family, and you will not be cost any penny. So this is a thing which people welcome because they fear the cost. You understand what I'm talking about? And they don't feel secured except they see something makes them calm and happy to receive the service, of course. And they won't be hesitated to have the blood examination and all that. And also, if there are any needs for supplements, for deficiency vitamins, deficiency elements in their blood, and they discovered any deficiency anemias or deficiency hormones or imbalance in the hormones, they should be checked and itemized to have the treatment. So I think this will be followed by another systematic treatment which gives the people results so they feel much better and they feel they were taken care for a lot. This will be a long and holistic approach which is never been received before. And they feel the difference in their health and their power and their capacity to work. So I think this area should be preceded by campaign in the media, a campaign in the TV and all the areas, and also they're spreading something written in the schools. And they have to supply the health service persons in each governorate or each village with some data which can spread it between the young children so they know and they can receive this service in the school also. They shouldn't be in the at homes. Homes will be taking care for the campaign of the health minister. And at schools, they should be taking care for the people who are coming in the school for the health, doctors or examiners to check and make the data and their cards and document it and register all that for each school.
Sure,
so,
right.
This needs a systemized and a very organized way to do the same campaign and to repeat it each by each governorate, because this will be something which will happen in Egypt for the first time and will bring a lot of data clear and will make a recovery for the Egyptian health, which can bring a lot of healthy people
Right.
working for the service of this society.
Right, Professor Dr. Hoda Rezkana, you are head of intensive care faculty of medicine, Cairo University. We'd like to thank you so much talking to the Breakfast Show. We're going to go to a short break and we'll come to continue, so stay with us.